I'm your host, Dr. Suzette Sutherland from the University of Washington today, and I'm excited to have Dr. Ann Cameron as our guest. All right, so let's just get started with the definitions of UTIs. When you talk to different clinicians, they use these definitions very differently. So let's just look, really by the book. What is a clinical UTI?
A urinary tract infection can be an infection anywhere from the kidneys all the way down to the bladder. What people often mean when they say, I have a UTI, is they usually mean a bladder infection or cystitis. And that's a bacterial infection of the bladder. You can also have a UTI, which is a kidney infection and a pyelonephritis, but that's a very different and much more severe infection. So a UTI, to be truly a UTI, the person who is suffering has to have symptoms. So they have to have the symptoms that are associated with the infection. And in terms of the bladder, that is usually urgency, frequency, bladder pain. They might feel like they're going to wet themselves, and they might go very, very frequently. On top of that, the person also has to have a test that shows that they have an infection. So either a culture of their urine that proves that they have bacteria in their urine, or sometimes we accept a dipstick. So this is very much like pool chemicals. You dip the urine and look at the results, and the results can show whether there's bacterial activity in the urine. So you have to have symptoms, and there has to be evidence of bacteria.
So when we're talking about just the general population, how common is it really, especially among young women or maybe postmenopausal women? How common is it that a woman gets a urinary tract infection?
So it's unfortunately very common. Half of women in their lifetime will get a urinary tract infection. So that's a very, very big problem for women in general, since that's half of women. Men don't get infections as often as women do, and men are closer to 10% likelihood of getting a urinary tract infection in their lifetime.
Yes, we'd like to think that whoever was responsible for designing our anatomy had everything in mind, but somehow the men have a very long urethra and with that are protected from having urinary tract infections or microbes getting into the bladder, whereas women are much more susceptible just due to normal anatomy. So you were also you're on the board of the Society of Urodynamics, Female Urology, and we're part of looking at the official guidelines that defined what are recurrent UTIs in women and then how we should be handling that. Can you define that for us? That's a different beast many times when someone has recurrent UTIs.
Yes, recurrent UTIs are when someone gets infections over and over again. And the formal definition is someone who gets 3 urinary tract infections in a year or 2 within a 6-month period. And this is actually not rare. Of all the women who get a urinary tract infection, around 30% will have a recurrent urinary tract infection definition. So this is not a rare problem or an uncommon event. It affects a lot of people, especially women.
Yeah. And then when we think about recurrent UTIs, I think it's always helpful clinically for me to think about sort of 3 buckets. Is a woman really getting a recurrent infection? In other words, it gets treated appropriately, some time elapses, and then they just get another infection from an outside source? Or was it actually inappropriately treated? Maybe they didn't get the right antibiotic. Nobody got a culture to know that she grew a multi-drug resistant organism, right? Or didn't get the antibiotic for a long enough period of time. Or the third category is what we call persistence, right, of a urinary tract infection. In other words, you have a culture, you see what the organism is, what's the right antibiotic to use, you treat it appropriately, the woman feels better, but then after a very short period of time, the infection seems to come back with the same organism. In that category, this sense of persistence, what we normally do to treat it isn't enough. We think about other higher level urological problems that might be coming into play here that's plaguing the woman and why you can't manage these recurrent UTIs. Can you talk about that a little bit? What kind of things as a urologist then are we really kind of responsible for looking for?
Yeah, so this is actually a really complicated problem. This is not something that can be solved very easily. It often requires a lot of investigating and a lot of discussion with your patient to figure out. Some women get an infection, or men, and they get prescribed antibiotics. And sometimes, as you said, it's the wrong antibiotic. It was an antibiotic that did not kill or eliminate the bacteria that they have growing in their urine. And that's often because they didn't get a culture. So a urine culture takes the urine and grows it on a culture plate. And they actually treat that culture plate with different antibiotics. So they know if the organisms are sensitive to a specific antibiotic or not. So if you get a urinary tract infection treated with a random antibiotic, one that we don't know is sensitive or not, you may be using the right antibiotic, and that's great, but you also might be using an antibiotic that has no ability to kill that bacteria or is only weakly able to kill that bacteria, which is an intermediate sensitivity. So you may take your antibiotic and it may make you feel a little better, but your symptoms come back very quickly because the bacteria was never really gotten rid of. So that's really a recurrent urinary tract infection, but it's more of a persistent variety, meaning the bacteria never really went away. Also, some people don't take their antibiotics as prescribed. So if you're given 3 days of antibiotics twice a day, you really need to take those antibiotics twice a day for 3 days. If you're skipping doses and not finishing your course, you're not getting enough antibiotic to truly get rid of the bacteria that's been bothering you, and you'll get a rapid recurrence of your symptoms. The other thing that happens is that some people don't always absorb the antibiotics correctly. Some women who have kidney problems and kidney dysfunction don't excrete the antibiotics correctly. And some people who've had gastric bypass surgery sometimes don't absorb antibiotics correctly. So there's a lot of different reasons that the UTI might not have been treated properly. The other problem is that some women are just very at risk for getting infections. So they may have things about their anatomy. They may not urinate properly. They may have a residual urine, meaning they don't empty their bladder well. They may have had surgery that changes the way they urinate. And some women catheterize their bladder to empty their bladder. So those are all very high-risk situations. So you might get reinfected very quickly because of these risk factors, and a new bacteria gets introduced into your bladder. And it can be really hard to figure out because E. coli is the most common urinary tract infection, 90% of all UTIs, and someone having 2 E. coli UTIs back to back doesn't really mean that it's a persistent infection. It could be just 2 brand new, different E. coli infections. So it can be a little hard to figure out, but it's really important to get cultures so at least we can compare infections and know if they're the same organism or if they're a different organism.
Thank you so much for listening. If you haven't already, make sure to follow the podcast, rate it 5 stars, and share with a friend. If you have any questions or comments, direct message us at _BackTable OBGYN on Instagram, Twitter, or LinkedIn. BackTable OBGYN is hosted by myself, Mark Hoffman,
and Amy Park.
Our audio team is led by Kieran Gannon, with support from
Josh McWhirter,
Aaron Bowles, Nick Shellcross,
and Ness Smith-Savadoff. Design and digital marketing led by Brian Schmitz, with support from
Taylor's Version Hess and Yvonne Obrzezinski.
Show notes and social media by Jody Lenora.
Administrative support provided by Jamila Kennebrew.
Music written and performed by Scott Baby Daddy Hoffman.
Thanks for listening, and we'll see you again next time. The views and opinions expressed by the hosts and guests on BackTable OBGYN are their own, and do not reflect the views or positions of their employers or any entities they represent.